How is a high-quality blastocyst identified in embryology? Have you ever wondered how embryologists determine the quality of a blastocyst during fertility treatments? Identifying a high-quality blastocyst is essential, especially in procedures like in vitro fertilization. A blastocyst is an embryo that has developed for about 5 to 6 days after fertilization. At this stage, it has formed two main types of cells and a fluid-filled cavity. To identify a high-quality blastocyst, several key criteria are assessed. First, the expansion and development stage of the blastocyst is crucial. Embryologists look at how much the blastocyst has expanded. Early blastocysts have a small cavity, while fully expanded ones have a larger cavity and a thinned outer shell. Generally, more expanded blastocysts indicate advanced development and a higher chance of successful implantation. Next, the quality of the inner cell mass is evaluated. The inner cell mass is the group of cells that will eventually develop into the fetus. A high-quality blastocyst will have a tightly packed and prominent inner cell mass with many cells. This indicates strong potential for development. The trophectoderm quality is also important. The trophectoderm forms the outer layer of the blastocyst and will develop into the placenta. High-quality blastocysts have a cohesive layer of trophectoderm cells that look uniform and healthy. A robust trophectoderm layer is linked to better implantation outcomes. Embryologists also use morphological grading systems to assess blastocyst quality. For instance, the Gardner grading system assigns scores based on expansion, inner cell mass, and trophectoderm quality. A blastocyst graded as 4A or 5A is considered high quality. The numbers indicate expansion, while the letters reflected inner cell mass and trophectoderm quality. Finally, implantation competence is a key factor. Research shows that blastocysts with higher morphological grades tend to have better implantation rates and pregnancy success. New culture techniques, like tilting embryo culture systems, are being developed to increase the number of high-grade blastocysts. For women with endometriosis, identifying high-quality blastocysts is especially important. Endometriosis can impact fertility, so selecting the best embryos can optimize the chances of pregnancy. Advances in embryo culture and grading help clinicians make informed decisions about embryo transfer. While embryo quality assessment is primarily morphological, emerging technologies like time-lapse imaging and genetic screening are being explored to enhance traditional grading methods. The overall success of in vitro fertilization depends not only on blastocyst quality but also on uterine receptivity and individual patient factors. In summary, a high-quality blastocyst is identified by its degree of expansion, the appearance and density of the inner cell mass, the quality of the trophectoderm, and its morphological grade. These criteria help embryologists select embryos with the best potential for implantation and successful pregnancy. Always consult healthcare professionals for personalized advice regarding fertility and embryo selection.